Good morning, everyone. Good afternoon, everyone. We are really excited to be co-hosting this webinar with our colleagues, ACT Africa. And on behalf of ACT Africa and all our collaborating partners, Stop TB Partnership, ENASO, UKPC from Uganda, the community's delegation, on the board of Global Fund, we welcome you to this amazing conversation. This is not your ordinary type of webinar, so don't expect to have presentations or slides. This is just a conversation with communities to be able to reflect what is happening in the current GC8 grant writing process across the different countries. So feel free, feel welcomed, loosen up, because it's just going to be a dialogue where we get to learn from each other. So once again, welcome very much. My name is Lisa Miriam. I am the Anglophone Regional Learning Hub Coordinator under ENASO. We are based in Arusha, and we are really excited to be collaborating on this conversation. So I encourage us to have strong participation. As I had previously said, this is a safe space where community leaders, civil society organizations, our country coordinating mechanism representatives across the different countries, technical partners, and diverse advocates will be sharing how they are shaping responsive and accountable HIV, TB, malaria, and RSSH responses, but especially how they are navigating the writing process in the different countries. We all know that, a lot has evolved. I'm sure most of us have interacted with the modular framework. We've been able to identify some of the key changes that are there. When we are in the writing process, we are also able to have conversations at our different country levels on how integration, sustainability, and even prioritization of activities is being done, right? So this is one of those opportunities that we really encourage all of us who are in this call to be transparent and to feel free to share so that we can be able to learn from each other. We do have an amazing set of panelists. We have a representative from the community delegation from the board of Global Fund. We do have key representatives from the CCMs across the three different windows. Windows 1, we have a panelist coming in from Uganda. Windows 2, we do have Ghana. And then for Windows 3, we do have Ethiopia as part of our panelists. So you can see just how rich this conversation is going to be, because we can be able to listen to the different experiences and be able to learn from each other. So today's webinar, I've already given you the overview. What we hope to be able to achieve from this is to be able to strengthen each other's efforts, so that even as we are undertaking the different writing processes in our different countries, we are able to apply what works best for us. And at the end of the day, ensure that community voices and community engagement are prioritized. So just to share a few ground rules for the conversation, please, as you enter in, ensure you put your mic off. We are going to be having a series of Q&A questions, but also reflection questions, where we welcome you all who are not part of the panelists to also share your different experiences and challenges, and the panel can be able to support with recommendations. So when that time comes, we are going to open the floor, obviously in a systematic manner, but also utilize the chat section to just introduce yourself, say which country you're coming from, which organization you're also representing, even your constituency, but also as you're listening into the conversation, feel free to share your thoughts there, and ensure that we respect each other's opinion, because this is a safe space for communities. So once again, welcome very much. And I would now like to hand it over to our collaborators for this webinar to just briefly share with us what's in the agenda, but also to officially welcome you and give us a brief on how the GC8 landscape is currently looking like within the Anglophone region. So Mr. Imoro Abudu from ACT Africa, welcome so much. The floor is yours.
Thank you, Lisa. And on behalf of ACT Africa, let me join Lisa to officially welcome all of us onto this great platform. I think the number one trending activity in the whole world is the GC8 processes. And these processes has been occasioned as a result of the fact that some allocation letters have been sent and GCA guidelines to also dispersed or distributed amongst countries. So there are a lot of activities ongoing in various countries with regards to these GC8 processes. Countries are currently preparing, reviewing, and implementing some GCA processes, and there's a need, therefore, for communities to be part of these processes as an integral part and to be at the center of everything that is happening in country. Why is there the need? Communities need meaningful participation. Communities are expected to contribute to the process, but yet still, many community networks still face some teething challenges. There's limited access to information. There's technical knowledge gaps. There's inadequate consultation opportunities available to communities. This webinar therefore seeks to build the capacity of communities to engage effectively and influence decision-making at the country level. So in effect, we want communities to be able to speak from informed positions, speak with relevant data so as to influence decisions at the national level. There is also the need for real-time experience sharing. Like Lisa alluded to, window 1 is almost done. Window 2 is starting shortly. But what are the best practices that have been recorded in countries? What are the challenges that have been recorded in countries? And what are the high-profile activities that are being upheld in country? There's a need we share real-time experience of this so communities can prepare for better engagement. There's a saying in Ghanaian language that if your friend's beard is on fire, you need to get a cup of water or a glass of water by your side should the fire extend to your own beard. So now that window 1 is almost done, we need to let communities know what the best practices are, what the challenges are, so they can be well prepared and make informed contribution in their respective countries. So basically, this webinar seeks to strengthen the voices of communities in respect of HIV, TB, and malaria, so as they can be able to contribute meaningfully. But then what do communities do? After your voice has been strengthened, after you have participated, what do you do? Communities identify priority needs. Communities networks help identify gaps in prevention, treatment care, and human rights services to ensure GC8 funding is evidence-based. We come to the table with evidence. We come to the table with CLM data that speaks to what we want to change. So basically, this is the essence of this webinar. And like Lisa said, it's a great platform for thought processes, for a meeting of minds, to share knowledge, to pick what is good ahead, and to leave what you can quickly leave so that you can be, your time will not be wasted, and to make sure we integrate and place our priorities high on the agenda at the national level. So basically, Lisa, this is what ACT Africa seeks to achieve as a result of this webinar, which is being organized in collaboration with our partners, including ENASO. And I think it will serve as a great opportunity for all to learn, and we'll leave here better than we came for this webinar. On this note, let me leave it here and hand over the microphone back to you, Lisa. Thank you very much.
Thank you so much, Mr. Abudu, for just setting the scene for us. And based on what you've said, I always say that communities are the ultimate sustainability plan, and that's why it's vital that communities are consistently mobilized and provided with the opportunity to influence our different national processes. So, and now I would like to move on to the next agenda. And in this particular session, we are going to just be looking at, what do communities understand when they hear of GC8 processes across the region? What is the feedback that is being taken back to global fund level? What are some of the trends that are being observed across the regions? But also, what are some of the opportunities that maybe we as communities have not yet identified, but we can utilize within the little time that we have left? Because time is moving at a supersonic speed. But also, what are some of those challenges that we are hearing that we think we can be able to support each other with solutions and innovations during this call that we can go back and cascade within our writing processes? And in that topic, I would like to welcome Maureen Mrenga from the Communities Delegation to the Board of Global Fund. Maureen, welcome so much. We are always really excited to have you on board. And please, as you speak to our communities, if you're comfortable, have your video on so that they can be able to see you. Welcome so much, Maureen. Let me pin you.
Thank you very much, Lisa, and thank you everyone who has joined. I think GC8, you asked a very good question. What do communities think when they reimagine GC8? And I think this is one of the most uncertain changing process I've seen since I started engaging in the Global Fund process. Like 1 minute you have these guidelines, next minute they are gone. 1 minute you have a process at country level, next minute the country team is changing it. So I think we are operating in very uncertain times, and I'll just give a little highlight of what we have had as a delegation on what communities are experiencing on the ground. So there's some CCM participation gaps. There's communication that is not very clear at the CCM level. So you find that some communities are feeling marginalized. So they are not able to engage confidently in the CCM. Rather, they are not sure that their input in the process is being considered. The second one was around late guidelines. Guidelines arrived late, and for for people of window one, they have lost an opportunity to take advantage of some of the guidelines that were community friendly. So because guidelines came late, I'm sure the countries may have advanced in the conversations, or if not, the process is being rushed and they are not able to meaningfully consult with their constituents and meaningfully engage in the process. Then there's the current issue around recommendation for a Z process where countries have one PR. This is very scary because when they talk about one PR or single PR, it means it's government PR. Most of the Global Fund funded counties have populations that cannot be funded by government. And this process is also killing our role as people who hold governments accountable. If you are an advocacy organization, I don't think those organizations will become SR, because now the PR decides the SR. So if the PR is government, you hold them accountable, or you belong to a criminalized community, then you may not be able. So advocacy is actually being killed at a time when we need to hold our governments accountable more. And then it's in countries in Africa that I think the KP services are at risk. There was a lot of quiet around KP. Right now, we are not sure, of how we want to package the KP services. At some point, we hear there's ban in language. At some point, we hear some languages are acceptable. So that, again, is a problem. And then I saw in some of the letters and recommendations from country teams that they are talking about the reduction between GC7 and GC8, and they are looking at low absorption and punishing communities for that. Some countries got lower allocation because of the absorption rate was considered, but who is suffering in the process? It is communities who are not, they are ignoring the structural delays and government bottlenecks. Then we see a GC8, if nothing changes, we see a GC8 where key populations' safety and access will not be guaranteed. It will become comme ça. So depending on how accommodative the country is, it is not for key populations to be SR in GC8, it is not a given. There is going to be need for a lot of advocacy. So I think I'll focus a bit on the move to single PR. And I think government PRs cannot safely channel resources to criminalized populations. Government PRs will not be able to fund advocacy. And then when they are talking about eliminating separate CSO subrecipient structures, I think there'll be no accountability to communities. There will be no independent CSO vote to flag any failures or violation of rights. They're also talking about the Z grant model is talking about consolidating grants under one national entity. And here we will lose the data we have collected through community-led monitoring. We lose community-level data collected by KPs, people living with HIV, adolescent girls and young women, TB communities. That data will be lost. And then they talk about the Z grant talks about reducing fragmentation by streamlining into vertical ministry structures. And then here we lose the CSO institutional capacity. We lose the dual track financing process that brought both state and non-state at the table. We lose the equity that Global Fund talks about. And if we lose it within these 3 years, I don't think we will gain it in the next cycle. If we lose it in GC8, I don't think in GC9 we can bring it back. So that is another challenge. You also told me to talk about what is working, what is promising. I think the countries that did community needs assessment before the CCM met to prioritize their interventions, that is a good practice. And then also those who have managed to fill in the annex, link it to the modular framework, post it, and ensure the priorities are in the proposal. That is also a good practice. For those who are still in the writing process, I think that is one area we should focus on. We are not sure how effective it will be in terms of when it reaches the TRP, but I think it's not an opportunity we want to lose. I think what we are doing right now is also a good practice. EANASO has been holding very many webinars to discuss GC8. It has been a learning and sharing platform. That is also a good practice so that people who have gone ahead of us can inform those that are coming from behind, or those that are yet to apply, or those that are still in the process. But what I would advise is that in the country, we always have different people. We have siloed CSO or community approaches. You find that TB community, malaria on their own, HIV on their own, KPs on their own. We cannot go alone anymore because we want to go far. We need to work together. So I think at country level, we should convene together, develop coalitions that brings all the different typologies of communities together to fight together, because I think as a sole or a single population, you cannot fight the power imbalance that is there between when government and country teams are together. And then ensure that in the CCM, whoever is representing you is very strong and able to articulate your issues, and keep asking them what is going on so that they inform you of any changes that are made to the process, because the process seems to be having a lot of changes. And then we would wish to map out your country's 1PR status. So Lisa has our whatever, and I'll type on chat our email. You can email us and let us know if your country has been asked to have 1PR and what is going on with that, if you're pushing back or if you are obliged, because I know Ukraine and Haiti's civil society PR was dropped off. And then if you're experiencing any challenges or anything you wish to raise with the board or the governance of the Global Fund, submit your formal written input, at least with evidence to the community's delegation, so that when we're submitting that query, we have full evidence that we need. Let's ensure that community-led organizations continue being named as sub-recipients and principal recipients where possible in the funding request. I saw that in this funding request, there's a place where they are submitting with the names of SRs, especially for those submitting a grant-ready proposal. So make sure that communities are not left out. And then for ENASO, I think our call to action is that you hold regularly such forums so that we are able to discuss and share what's happening at the country level. So some of the reflections I'll leave you with is that where are you in your country process? Are you engaged? And if not, why not? And please let us know how we can support you as communities delegation to better engage in those processes. So thank you very much. Over to you, Lisa.
Oh, wow. Thank you so much, Maureen. Every time you speak, we are always taking notes. There's always comments coming in and more questions. What I'd encourage you is not to leave yet, because I'm already seeing within the chat section, people are having questions for you and also reflecting back on some of the things that you have said. Honestly, the Z grant model is a little bit scary for communities, because they feel like they're being isolated and they can no longer be able to influence, decisions in their various countries, but also when it comes to them, being a voice, and it's honestly a little bit scary. I'm even losing words for that. But thank you so much for always enlightening communities and always being very intentional in cascading all this information, so that every person at the various community levels, at the various country levels, with our grassroots or national level, are able to have this kind of information. We are really grateful. So I'm just going to segue quickly into our first panel discussion, which is honestly a build-up of what Maureen has spoken about. And this is an opportunity where we get to invite some of the key players and partners within the different writing processes across different countries to be able to share with us their experiences on how they have been engaged in country dialogues. And then also, I did mention that we have representatives who are in window 1, which is about to conclude, window 2, which is July, and window 3, who are still in preparation mode in October. So they're going to be sharing, what are some of the things that they are doing in country, what are some of the things that they have observed, but also, how is inclusivity? Maureen mentioned that, with the way things are panning out, we don't have adequate time for participation, especially for those who are submitting in window 1 and 2. So which are some of the tactics that communities can utilize to ensure that participation across communities is being witnessed, it's transparent, and also there's continuous mobilization. So first and foremost, allow me to welcome one of our partners from Stop TB Partnership Nigeria, Mr. Mayowa Joel. Mr. Mayowa, Stop TB is a global movement. I know you'll be giving us the Nigeria context, but feel free to also share the information that you're gathering from the region in general on community engagement at the different level, at the different country dialogue levels. Over to you.
Thank you, Lisa, and good morning, good afternoon, everyone, everywhere. I want to commend the Africa Coalition on Tuberculosis and HIENASO for providing this platform for us to be able to share experiences from different countries. And special thanks to my sister, Maureen. Always good to hear from you, and of course, good to have you up there to provide guidance and support as necessary. So, like Lisa has mentioned, so I will basically be providing just brief highlights of what it's happening in Nigeria. I'm using the word is happening because it's still ongoing. And it's been a very interesting process, but it also has its own ups and downs, as everyone has mentioned, but more specifically, as stated by Maureen. So in Nigeria, the whole process of the GC8 also has started a while ago, and it has been a roller coaster drive. There has been a lot of success stories. There has been some success stories, and there has been some challenges. So let me start with success stories, and I'm going to be talking from the TB perspective, because as Stop TB Partnership Nigeria, we are coming from the TB angle. So for the TB stakeholders, there has been a lot of we have been very busy. Let me put it like that. Starting from early in the year, the first things we started with is the end time review of the National Strategic Plan. And then we also, from there, moved into the starting the development of the new NSP, the new strategic plan for TB, and then as well moved to the writing of the GC8. And that is in addition to other, activities that came in between. So it's been very busy. I can say that. And I think that is also one of the challenge, because when things get busy like that, when you have multiple things to do, then you need a lot of hands. And I think that is the one area where we also have challenge in among the civil society and affected community. We need more people that have understanding of this process and are available. It's important to know that it's not all the people that we need that are working for NGOs, and or if they are work for NGOs that have the time and availability to be engaged in these processes. And if there's anything at all that we still always struggle with, is to find people to be able to that are available and have the capacity to be engaged in all these processes, because they are not, they are not processes that you just come and sit down and look. You have to be effectively engaged and participate. We wish we can replicate people like Maureen, myself, and the other colleagues, we can clone ourselves and be in multiple places at the same time, but that's not possible. So I will put it across as a challenge and a recommendation for the need for us to start building to continue to strengthen the capacity of the affected community to be more engaged in this process, because sometimes like the case of Nigeria, you can have multiple processes going on at the same time. Okay, that's one. Number two, I want to say a very big kudos and thank you to CCM Nigeria that has ensured in every way that the community and the civil society are actively engaged in all the processes. And I can say they have endeavored to ensure that we're involved in all the processes and to provide the information. We get regular updates and information from CCM. And I think that is one of the benefits of having an understanding CCM and having a CCM that also supports the community, that does not look down on the community and that sees the community and part and parcel of the process. So that for us is one advantage that we have in Nigeria, which is working well for us. However, it also has its own limitation, because one of the challenge we have is, okay, yes, these meetings are taking place here and there, but the civil society and affected community do not have the resources, the support to be everywhere and everywhere every time. And this, I think, is one of the continuous challenge that we always have in the space, in the TB community space. Why is it that when it comes to laboratory issues, procurement issues, all these other issues, we always have support for consultants to be available? You have support for either members of the different disease programs, but for civil society affected communities, we don't have the needed support. So the few of us who are available have to struggle and stretch ourselves too thin. Like I mentioned, some of these processes that I mentioned in Nigeria have been going on, including the GC8, have been going on now since even last year, and then um, intensified this year, because as you know, Nigeria is applying for the first wave. So it's in fact okay. Let me also add to it. The global fund country team will be coming into the country from this weekend. They are going to spend 3 weeks. How many civil society can we get to be available, straight 3 weeks to be part of every meeting everywhere and so on, and all the other processes and activities still ongoing? So we don't have enough support, and it's so unfortunate that even some of us who have been able to mobilize, like Stop TB Partnership Nigeria, were able to mobilize a little support to support the engagement of some of our representatives, including the TB People Nigeria, which is the national network of TB survivors. But some of those support also come with conditions, like we don't even have support to be able to convey physical meeting. And Maureen mentioned this very well. We need to be able to meet before, during, and after the GC8 processes. If we cannot meet, yes, we may say, oh, we can use online virtual platforms, all this and that, but we know it's us is limitations. Okay, because when the concentration level when you're using online platforms is very limited, and you cannot be having online platform for straight 8 hours. You can have a physical meeting straight 8 hours for 2-3 days, but you can't do that with Zoom. I can't be online in Zoom for more than 2-3 hours max. Every other thing, I'm already doing something else. Okay, so these are some of the challenges we have. We don't have that support to convey. It is very, very important to state that, and that is very needed. Yes, we have a couple of one or two organizations in Nigeria that we've done online, meeting to talk about this and that, to discuss this. But again, those are limited to 1 hour, maximum 2 hours. And then moving forward, and maybe this will be the last point I'm going to make, is in terms of our inputs, our priorities. And I think that is where we need, as civil society, it's even more important that we have the opportunity to discuss among ourselves, so that we can harmonize our priorities. Our priorities, why, yes, they are focused more on, we need to focus more on availability of the drugs, availability of the services, ensure that we eliminate any form of stigma and discrimination that could hinder access to services. But there are other issues, especially that are very important and germane to ensuring that we are able to get the we have good success in the GC8 writing. Domestic resource mobilization is a key issue. And I tell you, one of the challenges that we still have in Nigeria is that up to now, the counterpart funding from the government for GC7, we still don't have it. And now we are going to GC8. And civil society, the affected community, have a role to play. So while we, as we are talking about other clinical or medical stuffs, commodities and the rest, civil society also, we need to prioritize discussion on domestic resource mobilization. In fact, it should be our number one priority, our number one advocacy agenda as civil society, because I heard about some of the countries that are either no longer eligible even for GC8, and some of the countries that their funding envelope was significantly reduced, like Senegal, for example. And I tell myself, if it's going to happen to Nigeria, what are we going to do? And if, especially if we don't prioritize as civil society, we don't prioritize domestic resource mobilization. So as I wrap this up, yes, we have had a good engagement in the GC8 process in Nigeria. There are a couple of challenges that need to be addressed, which boils down more on having the needed support. But overall, the engagement has been good. Yes, it can be better. But most importantly is that as a lesson from Nigeria and to other countries, let's prioritize the need for to intensify advocacy for domestic resource mobilization, because whether we like it or not, Global Fund has been there, but the situation is not the same as before. The funding landscape has changed, and at a point in time, we have to be we have to depend more on our government on to be able to provide the resources to take care of these services. On that note, I will say thank you for the opportunity. Over to you, Lisa.
Oh, wow. Thank you so much, Mr. Mayowa. We have plenty of lessons to learn from Nigeria. And please stay on, because I do see a couple of reflections coming in on the chat box that I'm sure you'd want to share more on in regards to your experiences and best practices that maybe you have not mentioned outside of what you have already shared. So thank you so much. And it's really good to hear, how CCM is coordinating at that level. So allow me to welcome our next panelist, Courtney from Namibia. Courtney, for you, the question is also the same. Just share with us what are some of the experiences, but also with Namibia targeting window 2, how does inclusion look like? Do you have intentional engagement of key and vulnerable populations in some of the consultations that are ongoing? How how are the grant writing teams formulating themselves to intentionally include AGYWs, key population, amongst other diverse groups. So welcome so much, Courtney, and please share with us your Namibian experience. Courtney, if you're speaking, you are on mute.
Oh, sorry.
Yes, welcome.
Hi, everyone. It's Courtney Reiniger from Namibia. I'm with the Health Alliance Namibia and also a CCM member. Thank you, Lisa. So for us, I think one of the biggest areas of engagement, and I tell this always to a lot of community leaders, is that we need to be intentional, especially now more than ever, about the representation of civil society on CCM, because this is the space that enables community voices to get into rooms where decisions around health priorities in countries are made, most especially around Global Fund. So we need to be intentional about civil society representation on Global Fund. And in Namibia, we are fortunate enough that the majority of CCM representatives are civil society members. So it is very easy in terms of civil society engagement in Namibia, particularly. What's challenging and difficult in that is that, yes, as much as there is adequate civil society representation, the decentralization of discussions is very problematic because, as previous speakers said, the lack of funding to be able to, bring together civil society, coordinated, organized civil society to be able to sort of like advance one stance and sort of like unified advocacy points and elements within these particular discussions is challenging. So we look at the second thing. So there is civil society representation, and we need to be intentional about it on CCM. Secondly, we need to make sure that those particular community-led, community-owned, community-based networks that operate at a grassroots level, those are the networks that we need to target. And it's working very well in Namibia because, as much as we're unable to reach the masses, being able to reach those community-led, community-owned initiatives and networks enable us to be able to gather and generate evidence and data that we are able to use for advocacy at CCM level and leverage around resource allocation and distribution, but also around program decisions that we are making. Thirdly, I think it's that we need to be intentional about being able to look at GC7, because GC8 is very different, as Maureen and others have been flecking, and we need to be intentional about how we approach GC8. So we need to go back to the data and program areas, methodologies, modes of implementation from GC7 and the years before that, and ask ourselves, uh, have we been doing enough? Should we continue doing what we have been doing? And how sustainable are these particular approaches? And we need to hold our current implementing partners accountable to be able to bring us together as civil society and be able, so that we're able to audit these programs and look at how best in GC8, with the shifts and the trends that are currently happening, how best are we able to then move the program or sustain the program as is, and use that particular data to our advantage as communities to be able to ensure, one, that in the disease split there is also negotiation and advocacy around the split between government and civil society. And this is very important because if you look at the absorption rate and the fact that, as Maureen flagged, that a lot of countries, including Namibia, got a reduced envelope because of the absorption rate, and a lot of the non-absorption is happening at government facilities or government implementing partners due to bureaucracy or due to their processes and systems in place. And civil societies, as much as they're implementing and as much as they are burning the funds, continue to suffer, communities continue to suffer because of what is happening in government. So we need to be able to go in with this particular data into this particular space of GC8, as it's very critical to advocate for adequate resources for civil society. And when we talk about adequate resources for civil society and program audit, the two things we need to look at: one is that every initiative that we go in GC8 to, there should be an element of sustainability behind it, as much, even if you're not a transitioning country, so that we are able to ensure, because a lot of countries, as it was flagged, are moving away from community systems into very
Courtney, you're speaking on mute.
again, sorry. So, as I was saying, every initiative has a sustainability element to it. And secondly, is that we need to make sure, even if initiatives or strategies are to be implemented by government, there is that element of accountability, program accountability happening. Because we have seen, particularly a lesson learned from Namibia, is that throughout all the other grants, there's not been enough community engagement and accountability mechanism. And I think that is why a lot of time governments are unable to absorb, because as much as they are held accountable at CCM level, that particular engagement at community level within the program and throughout the program was lacking. And for us, that is one of the things that we observed, lessons learned that we observed, that we are looking at changing. And then the other one, as Maureen flagged, also is coordination and civil society coordination. It is very important that we are able, that we come together, especially now. The two things we're talking about: domestic financing, and then we are talking about negotiations in terms of what is to be compromised and what is not. So communities being able to come together and coordinate and organize themselves and being able to go into this particular processes, that's very important. And from Namibia, we are very intentional about it. And we as communities, as civil society, we were able to come together and map a way of how we want the engagements to look like. Also, it is the definition difference between community and civil society and what that means in terms of engagements, because governments a lot of times will engage NGOs that have presence in the country because they are big enough. They don't do advocacy. They don't hold governments accountable. They are great that they have been engaging, civil society. So we need to be very intentional about how we define community and how we define it's at community level or it's at civil society level, and which civil societies are we talking about when we talk about that particular engagement, so that community voices, organic community voices, are not lost, and also that uh, organic community-based programming is not lost in this particular process. So yeah, for Namibia, we are very intentional about how civil society and communities are engaged and how communities are prioritized, especially in GC8. And then with relation to resource allocation and distribution, how that would look like. But one thing in terms of what Maureen flagged about one PR ship is that as a country, both government and civil society, we have the appetite for what PR, which is government, of course. And this is because as much as there is a lot of risk, we see a lot of opportunity as well in terms of domestic financing and holding the government accountable around sustaining the program beyond transitioning, and also the fact that government entities have the appetite of working with civil society.
How communities are embracing that, because your government is intentional in engaging communities as well as civil societies. But something else that you have said that's really powerful is, how do you differentiate community and civil society? And where do you place, the international NGOs that are also contributing towards, health systems within your country? So please sit back as well, because we're about to go into a reflection session. And I know some of the things you have said, we do have reactions and more questions from the larger audience. So as we're about to wind up this panel, just allow me to also invite experiences from Zimbabwe. And this particular person who's coming to share experiences from Zimbabwe is really passionate, is always updating us on, some of the key conversations that are taking place there, some of the processes, even the challenges. And I think it's vital that we also provide her with this opportunity to share that with us. And she's so flexible. She's accepted to come on a very last minute call. So Madam Tariro, I recognize you're currently in the process of grant writing. You're already in a meeting as we speak, but you're kind enough to share with us some of the key things that are coming out from Zimbabwe, especially when it comes to engagement of key and vulnerable populations, protecting their interests, and also Zimbabwe as a providing best practice when it comes to how you're coordinating civil society organizations and communities across the 3 disease areas, because you've been updating us on how you're doing that across HIV, TB, and malaria, and how it looks successful. So Madam Tariro, welcome on the floor. And let me just pin you. Madam Tariro, in case you're speaking, you are on mute. Madam Tariro, are you here with us? Okay, I think as she's setting up her mic, we can just, yes?
So can I get in? My name is Indy. I'm from Ethiopia, so I'm also a panelist. So
Yes, please, Indy.
yeah, I think you are about to call me.
Yes, you are coming up next after Madam Tariro, but please welcome, take the floor.
Okay.
Let me just pin you.
Thank you very much. Greetings, everyone. This is Indy from Ethiopia. So thank you for everyone, Maureen, Mayowa, and our sister from shared some very important, issues about the Global Fund concepts submission. But today, I just want to complement what they have been saying for a while. So I just want to emphasize on the issue, just for the sake of, since we have been discussing on the challenge. Ethiopia have been, in thorough process. We have been starting the GC8 process back in 2025. So we had a number of consultation and discussion, especially since we have a full review submission. We had a number of consultation just to because we have been reviewing the national strategic plan. So we had at least 3 to 4 consultative meetings just to do costing, modeling, and others, prioritization and others. That is, in one thing I can say, one of the good, side of the GCA process in Ethiopia. But in terms of, community engagement, I have some setback. Fortunately, I had a chance to engage in this process since 2014, almost 12 years ago. So in most of those events or submission process, we usually don't have issue in the beginning of the process, especially during consultation, during grant writing, prioritization, and others. Once when there is grant negotiation and during finalizing, the grant process, that is a big issue. For example, we usually left behind in those things. I mean, as many other African countries, the PR is the government. So the communities, the civil society is usually left behind in the grant implementation, in the last stage of grant making process. So many of our activities have been left out. So that was our big challenge. And not only that, even in the grant, I just want to mention the GC7. I mean the experience also. Especially in some circumstances, there is always reprogramming. There is some liquidation issue and others. In those situations, communities are the one who have been affected the most. During those, I mean, for example, budgeting, cutting, for example, the last US intervention, I mean, the funding cut, the reprogramming, the reallocation, rearrangement of those resources really affect the communities. Most of the resources allocated to the government were not even touched because they usually use the term, most of those allocation was procurement of essential medicine. So I just want to hear, the other countries' experience, because many of, the large sum of money, resource, and the grant submission was for the procurement of medicine and diagnostic. So that is usually non-negotiable and untouchable. So usually, sometimes it can even reach up to 85%, even more than that. So that really affect. The share of. The percent share of the communities and civil society become very low because the large amount of money usually allocated for the procurement of something, and procurement of like diagnostic or medicine or something. So those kind of things, they usually use this tactic just to undermine the communist voice. So I just need, maybe if you have any kind of any of our colleagues or meeting participants may have some kind of reflection on this. How do you manage such kind of tactics? If, for example, they are saying that the budget is for the procurement of medicine, and so you don't have any chance to ask for any kind of resource because the money is just we are about to, because it's procuring medicine sometimes maybe a big priority, but we don't have to compromise the role, the activities of the civil society. That is also another big challenge. In addition to the process, during consultation, it's okay, more or less there is some kind of engagement. During writing and prioritization and SCP review and everything, there is always some space. I can see at least we had a chance to attend some of those workshops and events, but in real term, during the one of the key stage of the grant making is the key. So during those stage, I can say communities totally left out because they are the one because there is back and forth with the secretariat or the therapy. So they have been asked to maybe cut this, do this. The budget is too high. Do this, that. In those process. The civil society, the Ethiopian TP community is usually left behind. That is also maybe I can say the big challenge. And also I just want to mention that, for example, the issue of PR. For example, as I said, the government is a PR, so they are the one who assign the SR. So they are the one who has to select. Even they whenever they say it is open and competitive, but nobody even know when do they really float the SR, the RFP, and when did they really sign? Usually for the last more than 10 years, I have been following, closely following the DF process. So the PR is the one who select something, but usually even even now, even at the stage of GC8 grant submission process, they even float some call. Unfortunately, even at the end of the maybe 3 years or something. So that is just not, for me, it was not that I can say wise enough to accommodate the community, concern, because they are the one who has to select the SR, and even they are not even floating the RFP on time, and even now the some of the SR, the what they call it, the SR didn't even start some of the GC7 activities, but they do some kind of report, and they liquidate the budget. That is a big concern from the Ethiopian TB community side. And when I said some of maybe can be the fourth very important issue, some key community activities. For example, the Maureen, she already mentioned about the community monitoring activities, some community outreach, and some contact tracing. Some key community activities totally left out, and I don't know how they raised a grant, but those activities were not there. So those activities, the secretary, since Maureen as a community delegation, she's here, so she had to. They had to make sure that there must be this activity, and they had to monitor the progress of the grant implementation. Where is the community monitoring activities, where is the CRG assessment, where is something they had to, in a specific community activity intervention, must have to be a kind of KPI from the secretariat or the community delegation, so that they can ensure accountability and transparency. So in that way, where is the community lead activities, or the procurement is there, you have been saying that we bought this, we bought that, and where is this intervention? The secretariats or those maybe supporting partner must have to ask those things. Unless and otherwise, it's very difficult to ensure the meaningful engagement of communities. There must be a way to ensure those activities were implemented by civil societies. So nobody even asking about those things. So now is GC8 is about to begin. So still the same old scenarios. And also, I have seen some gap in relation to collaboration between the diseases. For example, I'm representing the TB, but we have very limited. I don't know from the other countries, but very limited collaboration and partnership between diseases. For example, TB, HIV, malaria. As a civil society, they had to align themselves and fight and get those resources. I can see those limitations. There must be efficient and effective collaboration and partnership between diseases. Even I can see there must be even strong and aligned voice within TB communities, as well as across diseases. For example, from the malaria and HIV kind of things. And the other, maybe the fifth key concern. Many of our activities in the Ethiopian case in the GC7 was many activities were swallowed by the HSS. There is that during the disease split, there is TB, HIV, and malaria, and also health system strengthening. There is no specific amount allocated to the health system strengthening, but many of those activities budget were pushed to the health system strengthening, and the health system they usually took some amount of, maybe some portion of resource from the TB, HIV, and malaria. Fortunately, we had a chance to fight to keep the TB, the TB split safe. But some activities, for example, the community lead monitoring, we have been told that it is integrated for TB, HIV, and malaria, and nobody's even doing it. Even at the end of the GC7, we are about to start GC8, and I do have a concern. Those kind of issues maybe become a challenge in the GC7 process too. So I would urge maybe since there are a number of key individuals here, including Maureen and others, and Inaso, colleague Lisa and others, you need to find a way just to address those kind of issues. And also the one I just mentioned, that we always organize such kind of event during, for example, at the last stage of submission, for example, in GC7, GC8, maybe at the end of window 1 or window 2, or that in the last of September or June or something. There is no consistent follow-up. For example, we don't have, for example, an ASO Act or any other key stakeholder that must have to take this initiative to facilitate such continuous, not just at the at the beginning or at the end of grant submission or process. For example, on GC7, at the beginning of GC7, there was I can even remember we have been busy. There are a number of this kind of consultation, but for the last maybe 3 years or something, there is nothing. So for me, this is a weakness. So we have to find a way to strengthen and continuously follow the country level communities and civil societies. So this is a message for the arts or ANAS or any other platform who coordinate the regional regional engagement. So I would actually prefer there is some kind of maybe quarterly or something. There must be some kind of events, so that we may have at least we may have a Zoom chat, so that we may have a chance to update things and during grant implementation analysis. So, and the engagement even with the secretariat is very limited. It has to go through the CCM secretariat, and accessing those resources is very limited. Current and updated information from the secretariat is the key, so that we may have a chance to at least ask and make accountable the country level CCM and others. So we need information and a channel to get up to date country level, country specific information. Since CSO and CBA. So that is, I can see the overall reflection on the overall process of GC8 process in Ethiopia. We are now on the maybe at the stage of costing. I'm actually part of the technical working group, so not as usually a community, as maybe I'm a pharmacist and a health professional, but we need more strong and vibrant community engagement within the CCM.
Seeing a couple of comments and questions at the chat box, and shout out to Anil for supporting and responding to some of the questions that I'm seeing there. But do we have anyone who would want to take the mic and just reflect in just 1 minute per person, or even ask a question to our panelists? Do we have anyone? I can't see any hands up at the moment. This is your opportunity. Yes, I do see a hand.
There's a Paco, a hand up.
Yes, Apako.
Since I'm a panelist, I thought I could present. I'm having a reception at 2, and we're already close to 2, but maybe I'll just give more time.
Yes, we are just about to segue into your session. By that time, you will have spoken. Thank you so much for helping us take note of that. Do we have any participant who would like to take up the mic and just share a reflection? Okay, since I can't see any hands up, let me just read a few comments quickly, then we can segue into the next session, which is about how sustainability and integration is being considered and interpreted during this grant writing process. Season, sorry. So we do have Memoria who's saying the importance of ensuring meaningful participation of key population, including LGBTQ sex workers in the planning, implementation, and monitoring of programs under GC8. There's also need to strengthen community-led monitoring, invest in capacity building for grassroots organization, and address barriers such as stigma and discrimination within healthcare settings. Furthermore, programs should integrate human rights, psychosocial support, safety, and sustainability to ensure inclusive and community responsive interventions. Thank you so much for that reflection. We have Violet saying we need to include gender-based violence and sexual gender-based violence in some of our priority areas. We have Koch saying we emphasize the importance of ensuring meaningful participation. I think this is a repetition of what I had just read. And then we do have Anyambura saying we need to include children of key population within the health packages. That's an interesting reflection, Anne. So thank you for that. And she also goes ahead to say that we need to ensure that human rights are protected and ensure that we approach the writing season with people-centered approaches. Thank you so much, Anne. Please continue sharing your reflections at the comment section, and any questions, the panelists are happy to respond to you there. So allow us to quickly segue into our next panel session, and I'm gonna invite Courtney. I do see your hand up. Is it something you wanna say quickly before we segue?
Yeah, it is something I wanted to reflect on in terms of also Ethiopia's reflections. I think in terms of the advice, I think one of the most important things that we need to look at as CCMs is how we self-coordinate as civil societies, because a lot of times government institutions have meetings behind and before CCM meetings as well. And if we don't self-coordinate, they come in with a unified sort of like stands and decisions already in CCM meetings also. So I just wanted to like advise the colleague that he engages other civil society CCM representatives and that they self-coordinate so that every time they step into those particular CCM meetings and other decision-making rooms, they're able to speak from a unified point of view. And also in terms of SR selection, a lot of times SR selection happens at PR level. And as much as CCM is not involved in that process, it is important that processes are endorsed by CCM. So as civil society representatives, we need to self-coordinate so that we make sure whichever civil society SR implementer that is selected is an implementer that has a good relationship with communities and community-based organizations and networks, and that whichever SR is selected is an SR the communities are able to engage with and work with. Otherwise, we stand at very high risk of losing a lot of advocacy work. And also in terms of disease program fragmentation, that is true. I think that is a global challenge. I was just in a meeting the other day, and that is also what other countries are flagging. But I think one of the key opportunities that we have in terms of coordination and bringing together bringing an end to that fragmentation is GC8, really looking at integration and being able to flag that integration is key. And also I know that at country level, especially in other countries where the legal framework is very harsh and hard, governments tend not to want to work with civil society. But I think that's the role of CTs also. If governments don't want to work with community-based organizations, I've a lot of times had situations where I have to directly write to Global Fund and I have to directly write to CT, and I had to tell them, if you don't get involved, we are going to go to the next point and to the next step, because there are channels available if at country level you are not heard of because you sit there representing a broader community. So if your voices as civil society are not heard, to even if you are representing one community and your voice is not heard, it is very important for you to map those particular channels that you can involve, and so that you are able to go to those decisions are being made, because it is your right to make those decisions. Thank you.
Oh wow, thank you so much, Courtney, for those reflections. And I know it not only applies to Ethiopia, but everyone here who are experiencing the same challenge can be able to utilize some of the approaches that you've shared. We're really grateful for sharing that. So allow us to quickly segue into the next session where our much. Mr. Imoro, over to you.
Thank you very much, Lisa, once again. And let me say a big thank you to all our panelists for their wonderful submissions. We move straight to our next agenda item for discussion. This item will be looking at integration, sustainability, and emerging priorities as far as the GC8 processes are concerned. To help me do this discussion, or to help provide real-time information and solution to this, we have Apako Williams, a member of the CCM Hub from Uganda, and also Maureen Moringa, Community Delegation to the Global Fund, but she's a member of the other place. So I'll start with Apako Williams, since you have a program that is very close. So you can take the first question. How are countries interpreting integration across HIV, TB, and malaria, and also under the Resilient and Sustainable System for Health, RSSH? Over to you, Apako.
Thank you so much. And I'm going to take off my video for purpose of being a bit more clearer. And I want to appreciate the previous speakers. I would love to say that most of the contexts are not different from Uganda. And even the examples from Ethiopia are really shared examples. This transition process is really taking shape, but also affecting us as communities in different ways. And for us as Uganda, we're not taking GC8 as a grant application process. We are taking it as a test of political will, governance, and country ownership. Because at the moment, as a key population leader and the key population person, I think that for us, integration, sustainability, transition preparedness, and shrinking finances is something that countries are trying to navigate and even wonder how best they go about it. But mostly in Uganda, communities are questioning whether integration will strengthen or weaken differentiated responses. And that's where we are at. Given a case scenario in Uganda, currently in Uganda, for example, the funding split, Uganda's state allocation approximately was about 521 million, but 81%, about 420 million, was allocated to commodities and direct service delivery. Only 19% remained for broader system strengthening and integrated investments. Within this balance, only about 5% remained for RSSH and community system strengthening. So communities fear that prevention, safeguarding, and peer-led systems may become under-resourced under this new program. Also, communities are experiencing that there are compressed timelines and consultation fatigues are weakening meaningful participation. Because for us, it's been very intentional. Consultations have been very key. We will really never blame the government that they did not do a good job to ensure the consultations are key. Because for us, our processes were funded by the government of Uganda. But communities are often invited too late to influence prioritization and budgeting decisions sometimes. But also the shrinking civic space and human rights concerns are affecting engagement, especially in Uganda. where we have the Anti-Homosexuality Act, and we also have currently the passage of the Protection of Sovereignty Bill, which is being used to directly target civil society organization. And we think health integration is really accelerating faster than transition plans for community-led systems. For us, the integration debate actually, countries are interpreting integration differently across HIV, TB, and malaria and RSSH. But as a community person, I feel like integration is really both a positive and a negative, but also presents very key opportunities, because through integrated methods, as communities, we can safeguard community-led interventions. And I think many governments frame integration around efficiency and cost saving, and communities support the integration but not the invisibility. So we also have the peer-led systems. For example, drop-in center and safe spaces remain essential for underserved populations. And currently, we as the key populations are quite very scared with the passage of such laws that we don't know quite how best the drop-in centers or community-led interventions are going to fit in best within the government programming. And then we also have the poorly managed integration risk weakening differentiated services. In the human rights angle, I said earlier, the policy environment strongly shape implementation for us in Uganda. And in Uganda, the Homosexuality Act has created fear and uncertainty for the key populations. Whereas after 2013, we had the anti-homosexuality bill annulled. And this bill came with provisions that are quite criminalizing, but also not favoring the key and priority population. So we are quite very uncertain. And communities stress that trusted peer-led systems remain essential for reaching criminalized populations rather. And we want to ensure that there's trust, safety, and accessibility for service delivery. But also the tensions that merge is that there's vertical programming versus the integrated health systems. We don't know how we can really merge those things. But the biomedical priorities versus community engagement realities. There are community engagement realities that are beyond the biomedical priorities that are being, prioritized. But also, I think there's efficiency and compliance, which versus equity and inclusion. While we're looking at the efficiency and compliance of course, very many different standards and also being even compliant to the government of Uganda, there's an aspect of our equity and our inclusion as civil society, but also as key population organizations. But also, we think around the national ownership versus shrinking donor financing and transitions. We've seen quite a number of donors cutting funds. We've seen quite a number of the funding landscape shrinking. So as a community, we are wondering how best we can really bridge the gap around community ownership vis-a-vis competing for funding with even government. Because at the moment, the likes of USAID, we're funding both civil society and also government. But at the moment, we are really now competing on the thin resources that the government has left for us as community. Moreover, if you look at 19%, which is RSSH, but also the 19% is also contribution to community, is quite doubting. And the grant writing processes, I think the consultations have been very inclusive, very clear, and we've had meetings at the UNA, we've had meetings at UNFPA, we've had the Uganda Key Population Consortium strongly coordinating interventions for key and priority population. But we've seen a surge where that Uganda is going for grant-ready application. And you find that in the room of applications, we have over 60% of the room is full of government officials who are more of technocrats and really the people they know as the experts. And now that also brings a challenge that before, as the key populations, we had our own consultant who had been attached to us directly to us ensure that our issues are really directly inputted into the document, but also ensure that there's meaningful and really responsive involvement of key and priority population. And now at this moment, we are really quite really not very sure about what is next. The data and evidence challenges, the routine systems often fail to capture the impact of peer-led interventions. The peer-led interventions have been really not taken into government, and I think integration also looks at the peer-to-peer led models being integrated, but we don't know at what extent and what level the government is really going to ensure that, as LGBTI community to be precise, they will really involve us and engage us with even now such a law in place. Then the key population data may be politically sensitive and underreported, and that is something that we are seeing in Uganda, besides the qualitative aspect of quantitative to qualitative interactions. We had regional engagements, we had national consolidation meetings, we had inter-constituency engagement, and like I said, it was very deliberate, and communities have been really part and parcel of this discussion. But up to this rate, we are seeing that civil society interventions most of the times are being thrown out with the fact that they are not really up to standard, but also don't speak the language that the government of Uganda thinks that these things should speak. And some of the case studies and those scenario, I'll give an example, is that as civil society, but also as key populations, some of us are operating drop-in centers, but also community clinics. And with that, the government or the consultant writing the proposal feels that community clinics should be termed as private sector related interventions.
Okay,
and with
awesome.
that, sorry?
Awesome. If you can conclude for us, wrap up.
And with that, we've seen that somehow private sector has also been put as part of civil society, yet we are calling for domestic financing and co-financing, and we are looking at people like the private sector. So those are some of the issues that we feel are quite daunting. But the emerging lessons from the ground is that participation alone is not enough. Communities need influence. And for us, we think meaningful engagement requires timely access to information and technical support. And integration must strengthen, not erase, community-led responses. We also think communities must organize collectively beyond consultative spaces and ensure that they're very intentional and even come up with documents that are backed up with evidence, backed up with all the clear data and facts that we can present beyond us coming to start struggling with what government is presenting as the data that the community has. Then the strong accountability mechanism have to be enforced and put in place, especially within the Global Fund, but also with us. Then the sustainability conversation, to be honest, sustainability discussion affects focusing heavily on commodities and government systems. But sustainability must also protect community networks and advocacy ecosystems. We are seeing that the peer-led service delivery and community resilience require longer-term financing. And as communities, again, we are wondering, with such a law in place and specialty law, are we able to actually get issues of sustainability, co-financing, domestic financing, and of course proper transitioning of interventions? Is a question we are really wondering about. Communities, I think what they need to move forward is strongly call for stronger technical literacy on global fund architecture and modular frameworks, which we've done very well as Uganda. But we also think as countries, we need collaborative effort across different regions so that we have some level of influence in terms of experience and also what other countries are doing. But also recognition of community system is very key as part of our government in one way or another, because what the government looks at as community for us is the village health teams and the community health extension workers. And in the definition of communities, according to government, civil society, all key populations have never been really part of their community, but they are very intentional when it comes to the processes of writing. And for me, the key message I'll really send out to close is to say that intentional, like Cotton said, but also communities should be beneficiaries and not and implementers rather for this intervention, rather than just participating in processes and not really being direct implementers. I think with that, I will say that Uganda is going to grant ready. And in my conclusion, the PR has the capacity to select who the SRs are going to be in the document. And as civil society and key population, we're ensuring that at least the key population consortium of Uganda comes out clearly as an implementer so that they can really support other networks and other civil society groups that are really doing work within this same landscape. I will beg to submit and thank you so much.
Thank you very much. Awful. That is very, very good. You've given us a mouthful of relevant experience and best practices. Because you don't have much time, permit me to just close this chapter with you by taking you to my next question so that you can have time for your meeting as soon as you are done. So my next question is, what are the implications or what implications are emerging from sustainability, community systems, and service delivery, especially in Uganda?
In Uganda, honestly, we are still challenged, especially in terms of issues of sustainability, because with the funding cuts, communities for LGBT persons, to be more precise, were heavily, and civil society were heavily funded by foreign funders. And at the moment, you find that most of the funders have dwindled or they have really, really disappeared. And at the moment, there are donors who are giving us, transition plans and also final allocation letters, even beyond Global Fund, to ensure that we sustainably try to have interventions that are, more longer term than shorter term. And with this, what we're trying to do is ensure that however much there's a law against us, however much the government has frictions, we as civil society and key population have the only opportunity to ensure that we hold our governments accountable, continue engaging with our government directly, but ensure that communities are not independent of government. And in one or another, if we're still living in Uganda, we cannot be independent of the government. So we need to take a very lean step back and think about the most strategic approaches around transition planning, around sustainability, around co-financing to ensure that as Uganda, we really don't miss out on this. As much as there's a law, the government knows that civil society and also key populations are part of Global Fund. They know that we are there, and they really recognize our presence, because every day in the meetings I endorse my name and ensure that I write there as a transgender person. So these are things that we will say that are more lengthy conversations, but I think within the 3 years of funding, as Uganda, we shall really push to ensure that the government takes care of our health and ensures that beyond advocacy, our health and well-being is really, really well taken of. And of course, not forgetting that we need to ensure that we strengthen sustainable means between government, civil society, and key populations through working together, through collaboration, through partnership, but also as communities, we've been made as drug distribution points. That's how they're calling us in the document. So as drug distribution points, we shall ensure that, of course, we ensure communities receive services, but also information cuts across from one persons to another. For us, sustainability has been the fact that there's been weaker systems within civil society and key population programming, weaker community donors from, more longer term funding as opposed to one-off funding, which is always 1 year. And I'm seeing a really big struggle for communities to get back on feet. For some of us, we're lucky, we had, put up structures and of course have offices that we own. We are not really staying in rental places. But for other communities, they have really been forced to close. And that really looks into us taking the word sustainability of community interventions as key as possible. Thank you.
Thank you. Awesome. Thank you very much for your submission. And on this note, let me crave your indulgence again. There are a lot of questions already in the comment section for you. So I'll let you answer one question before you can leave. And that question is, how will community feedback and lived experiences be incorporated into monitoring and evaluation processes under the GC8. This will be your last submission, so I can let you go. Thank you.
So community feedback is very key because as key populations, we are really working almost at the mercy of God or the mercy of the government of Uganda. So it's through the dialogues, it's through community feedback that we can actually input into the monitoring and evaluation rather, but also ensure that there's continuous community-led monitoring. And for us, this time we're going to be very intentional and ensure that community-led monitoring comes out very clear, because that's the only data that is up to date, that is timely, that government can use to ensure that we continue receiving services. Most of the work we've done out of government, most of the research studies or data that we've done out of government have been not approved, and I think they've not really met the ethical standards of doing research. So these feedback mechanisms are really key, and continuous community accountability mechanisms should be reinforced to ensure that communities have a strong win-win situation. But I think this time around we should have the integrated community-led monitoring. And I appreciate integration for one reason, because let a community member go in a particular facility, and even if they've gone with a leg broken, let them at least leave when they know their HIV status. Let them leave when they know they are safe for malaria and TB. And for me, I think that is a plus. But also, we shall ensure that the community strength and feedback mechanism is part of the discussions. And like Uganda, I told you earlier, we've done a lot of back and forth. There's been meetings at the AIDS support organization for civil society organizations to ensure that their issues come out very strong. We are very intentional, and we are really on demand. And if I'm not able to be in a room, I'll ensure that part of my colleagues are in the room to ensure they're part of the processes, part of the feedbacks, part of, ensuring that we don't miss out in this work. Thank you.
Thank you very much. It's becoming hotter, and it's like people don't want you to leave. I've seen a hand already up, and let me crave your indulgence again to just spare us a minute to attend to that person's question. Once more, Melewa, please unmute yourself and come on.
Thank you very much. Thank you very much for that presentation. I think what I really wanted to ask is, and this goes to the question of integration again. I've participated in quite a number of community consultations, engagement, including the fundraising process. But there seems to be quite a confusion that in as much as the Global Fund is talking integration, if you look at most of the allocation letters, they are coming up with disease splits with actual amounts. HIV is this money, TB is this money, malaria is this money. And when it comes into the writing, still you are having teams disintegrated into HIV, TB, and malaria, writing the different components. At what time does then integration come in? Because it seems like integration is being spoken, but when it comes into the actual doing and the planning and the intervention planning, still we are regressing back to the usual style of doing our interventions as per HIV, TB, and malaria according to the disease split as indicated in the allocation letters. At what point then are we really ensuring that interventions are actually being formulated in an integrated manner in alignment with the integration concept as propelled by the Global Fund? Thank you.
Thank you once more. And over to you.
And I appreciate that he asked this question, and this is a question I'll throw back to all of us in the room. Onesmus has been one of the people who has been helping Uganda write their priorities, and he was really supported with CRG to help that civil society and key populations in Uganda have their issues well articulated, but also up to the standard that the government of Uganda wants. I will say that for us, it's been, of course, splits. It's been different diseases, HIV, TB sits alone. Sometimes, honestly, I'll tell you that sometimes you go in a room and you're quite confused on where you're going to sit. You're affected by HIV, you're affected by malaria, you're affected by TB, and you find that for key populations, we've only been seen as HIV/AIDS related barriers. We are not seen as TB, we are not seen as malaria. So most of the times we're abandoned in the working group of persons with HIV/AIDS. But also, like I said, Onesimus, Uganda has been very intentional with quite a number of consultants and technocrats from government. As we are writing, there's somebody who is doing the costing. It's happening at the same time. But also the number of meetings that have happened, I don't know, because of the funding that came from the government, are quite too many. And sometimes we wonder whether these meetings are happening at an intentional manner, or even, like Courtney said, that sometimes government are hiding and holding meetings in the nights. And it's very surprising that the governments will actually intentionally sit back and wait for civil society to walk out, and they continue having their private meetings. But the question of at what point are we going to ensure that these things are really integrated is something that is still daunting. But I think as we continue writing, as I speak now, there's a meeting at UNAs that presenting to communities. I think after that, then we are going to really meet and ensure that we consolidate all the efforts and ensure that we apply a single window sort of application. And like I said, Uganda is going grant ready, so they are taking every opportunity possible to ensure that every time is utilized, to ensure that we meet time and beat the time, but also ensure that the document goes when it's really clearly well aligned. But integration is a question that the whole room should ponder upon, and at what extent is communities really going to be involved in terms of integration. But what I know is that processes are taking precedent, and I'm sure, Onesimus, you'll be one of the people who will be called in the room. If not, we shall use you to lobby and push further. But I'm very keen to the day we are going to go and meet to consolidate and now have one document presented.
Thank you very much. And let me encourage everybody, if you have any lessons to be learned, any challenges, kindly make use of the chat box so we could collect a lot of information from you also. But then there's also another hand, like I said, it's becoming hotter, and I'll still crave your indulgence, Apako, to take this last question from us before you leave. From the venerable Peter Owiti. Peter, the floor is yours.
Thank you very much, colleagues. Can you hear me?
Okay, yes,
can you hear
ahead.
me? Yeah, thank you so much, and thank you for the presentation by all the colleagues. I don't know if Maureen is still here, but in the Grant Cycle 7, we went through the process, and there are issues that we raised that we saw were not going well on the terms of communities. And we raised this issue with the country team, but it never went anywhere. We were dismissed. We really struggled for the attention from the Global Fund Secretariat through the and it didn't work. What is going to make it work again this time when the time is too short that we cannot just overindulge in those barriers?
Thank you very much. Okay.
The question seems to be to Maureen as well, but I'll give my brief. I will share that try your best to be very intentional. Take every room as important as possible, and every opportunity to be in those spaces as important as possible. But as civil society and key populations, mobilize yourselves. Make sure you have a team of people who are ready. If you're not available, please run there. If somebody has traveled, sit in for them, but also ensure that information cuts across. What you've learned, what you've gained, please pass it on to the other participants. Because there's been situations where you send participants in Uganda, where you send participants and for them they're presenting their organizations, and that's something we found as a challenge. And we came back to the ground and presented our case as civil society. Right now we have the chairman of the civil society groups who we really charge to be directly involved to ensure that he tracks everything that is going on and informs us on time. But also we have the CCM Secretariat, which for me and other people take very seriously, because for them they're intentional. Even if there's a meeting and you missed out, when you send an email, they will definitely invite you immediately. If you make a phone call, they'll put you part of the discussion. So I think let's not take this as friction, but use it as an advantage to really get close to the government. Because as a transgender person, I'm proud to sit in those spaces, and I'm proud that I'm interacting with government, whether they accept or they don't accept. But we should be in the room.
Awesome. Thank you very much. Thank you very much. On this note, I can authoritatively say you are discharged, and thank you for staying back to attend to us, even though you have a pending meeting. Thank you very much. So let me,
Thank you.
on this note,
Great deliberation.
Okay. I want to use the opportunity to outline some forward-looking interventions that Art Africa, as a regional network, is implementing to support the GCA processes. We currently undertaking a survey at our website. We want to collect information, capture realities on the ground. Let's know what is working, what is not working, what are the gaps, so we can help in getting all this information from you that will be used to shaping the future and current practices as far as the GCA process is concerned. So the survey link will be shared on the chat box by Lisa. Kindly take a minute to attend to the survey for us. Your information is very, very crucial, and we need to get your perspective as far as the GCA processes are concerned. We also have a dedicated website that will christen it GC8 Situational Room. This website is made up of a crack team of resource persons, community people who know the ins and outs of GC8, and they are readily available on standby for questions from communities, and they'll give real-time solutions when you attend to us on the website, on the WhatsApp. So please, we'll be sharing the link of the WhatsApp platform. Kindly join, and you have a team readily available to provide real-time information and solution to your needs as far as the GCA processes are concerned. On this note, let me hand over back to Lisa for her to continue the program. Thank you very much, and thank you for your attention.
Okay, thank you so much, Mr. Imoro. I just want to share my appreciation for you. I have shared the survey link with everyone in the chat section. I do recognize that we are about to, end, because we are so close to the end of the webinar. However, just allow me to quickly give a summary of what all the speakers have spoken about before I thank them, and to see if they can be able to respond to one or two questions that are still in the chat. However, I'm encouraging our panelists, please interact with the chat section, so that in case we don't have time to fully address all the questions and reflections, you can be able to respond to our participants. So thank you so much. So as you have all heard, this was a very timely conversation. And let me just start by apologizing. I recognize there was a point where people could not join. It kept saying that the meeting room is full. So apologies for that. We are going to improve on the settings next time. But all of our speakers have been very generous by sharing their country experiences, their lived experiences, but also key advocacy recommendations. And some of the key things that have stood out is, one, the advocacy space is shrinking to an extent, especially with the continuous changes that are happening with the guidelines that have been shared around GC8, but also it's important that we do not forget the lessons that we learned from GC7. Even with the differences with the two, at country level, let us utilize the lessons learned from GC7 and also GC7's reprioritization process, and find a way of linking that to the GC8 grant writing process, and ensuring that we are able to safeguard our priorities, and we are able to continuously advocate, not just during this writing period, but also continuous advocacy at national levels within our different countries. Something else that has arisen is the continuous gaps when it comes to community engagement, but also CCM engagement. And I saw someone in the chat ask, how do you define communities? Because sometimes civil society organizations are categorized as communities, and sometimes they are categorized differently, right? So how do we get to define that? How do we ensure that we don't have participation gaps? I saw someone in the chat also saying HYW and young people keep being given promises of participation and meaningful engagement within such vital processes, but the opportunities are really minimal, you know? So like, how can we strengthen such areas, especially for countries that are still actively writing for window 2 and window 3, where we still have a little bit of time? Then something else that came up was that communities have not gotten the chance and the time to fully understand the guidelines that have been provided. One of our speakers said that, you know, their country has not even broken down the modular framework for communities to really understand, and also for CCM members to really, you know, contextualize it properly. So that is a key gap. And Maureen did mention that some community guidelines that partners in the learning hubs across the regions are releasing, they're coming in a little bit late. And because of the tight timelines for the writing period, communities are not really able to utilize these resources. So that is also an opportunity that we can quickly jump into, provide newsletters, provide summary and briefs, but also have utilize platforms such as this to be able to break down these guidelines to support communities so that they can be able to cascade some of the lessons learned and recommendations and action points into their writing processes. Also, something else that stood out was the need for continuous domestic resource mobilization, because the donor funding space is shrinking. As everyone has said, allocation letters came, with reduced allocations.
Juste ça.
Someone saying something?
Oui. I
Papa,
don't English.
Ndiaye, is it okay if you muted yourself, Papa? I'll give you a chance to speak just shortly. Thank you. So how can we as communities continuously work with our governments to ensure that even at their level, they're able to allocate adequate resources to sustain the programs across the 3 disease areas? Then something else that came out was prioritization versus negotiation. And how can we equip communities to really understand what are those things that they need to stay a priority? What are those things that, you are gonna fight neck and bone to ensure that they still appear at the final funding request? So how do you negotiate actively with communities, but also with the key government stakeholders, especially where we are having governments as PRs? And then something else that came out is that because of the tight timelines, some communities may feel a certain level of consultation fatigue because meetings are back to back, either virtual or, in person. They really don't even have time to do other things. And sometimes that level of speed can cause a certain level of fatigue, which can negatively influence how communities participate. That may be something that we may need to be innovative around, because community engagement is really, really critical. And, someone once said that no matter what happens in life, always move as an ambulance. So that means that despite the fatigue, despite the tight timelines, this is a sacrifice worth making for communities. For consultations. And then something else that stood out is, how can community realities be prioritized, be recognized, and how can community realities be prioritized and be recognized in regards to comparison between biomedical programming, prevention, and procurement prioritization, which seems to be the recurring theme across the different countries when it comes to the allocations that are provided. And then also, how do we utilize the support of development partners so that we also don't fully rely on government support when it comes to community consultations? How can we bring on board the INGOs that also support us? How can we utilize the opportunities by Global Fund to also ensure that community participation is active and intentional? And last but not least, is how do we also ensure that across all the 3 disease areas we have adequate representation and we do not leave out RSSH. So those are some of the key summary points that I've been able to document, and we will be doing a post-webinar brief so that some of the things that I have not mentioned, you can be able to interact with them as well. So mine is just to really thank all of our speakers, to thank our audience. I recognize it's lunchtime in some areas of the world, but you've still held it down to participate actively. We are truly, truly grateful. As Mr. Imoro said, we do have an open survey where we are documenting insights as well as experiences of GC8, and it will be up and running all the way until, late towards the end of the year. So the insights will be documented live on a dashboard on the ACT Africa website. And feel free to also join the WhatsApp group, which I'll also be sharing the link here on the chat section. So mine is just to really appreciate each and every one of us for our active participation. We do have 5 minutes left. If we want to hang out and just respond to a few of the questions, I had seen Courtney trying to respond to a few, especially on the question of how do you define communities, where she said that 1, communities must be grassroots, communities must have beneficiary membership, and also communities must have a presence, as well as communities must be able to have the opportunity for advocacy, the skills for advocacy, and to hold governments accountable. So that is how she defines communities. But once again, let me hand it back over to ACT Africa, Mr. Imoro, to do the final closing remarks. Thank you so much.
Thank you very much, Lisa. Thank you.
Thank you.
Everything. Thank you, Ian. So thank you, our partners. Let me thank everybody who has taken time off your busy schedule to be part of this great platform. We want to thank our panelists for their dedication, for their support, and for the sharing of relevant information as far as this webinar is concerned. Thank you, all of them. Thank you, Lisa. You've always been there for us. We are grateful. Thank you, Ienaso. And thanks to everyone. Let me conclude by saying that we have a series of these webinars coming up, and do not hesitate to join anytime you see them, but we want to bring in relevant practical information and solutions, best practice to shaping our resolve and make sure community priorities are on top over there as far as the GCA process are concerned. Thank you very much, and God bless all of you. Bye-bye.
Bye.
Bye, everyone. Thank you so much.
Bye, everyone. Thank you.
Bye. Thank you.
Bye, everyone. Thank you very
Bye-bye.
much.
Thank you.